Hi everyone. Today I'd like to talk about punctuation use in scientific writing. Um, Quite often, one might see erroneous, shoddy punctuation use in a published research paper, and when such a situation is observed, it can really diminish the credibility, authority, and ultimately the reproducibility, perhaps, of your work. Remember, punctuation marks are devised to eliminate ambiguity, so they should be applied prudently and consistently. Um, in general, shortened sentences require less punctuation than longer ones. And the most common punctuation marks in scientific writing are the comma and the period. The comma is more flexible and more versatile of probably all punctuation marks. And because it's the least empathic, that is forceful and clear, um, punctuation mark, it's also the most complex and subtle. So writers may feel an uncertainty about its use. Wrong comma placement, it's quite common. This stems from people thinking of them as breath marks, which may have been true when English language was largely written to be spoken, but today, comma placement should indicate grammatical logic instead of indicating rhetorical pauses. Um, Most writing today, including scientific writing, requires commas to serve a logical purpose, typically to separate different thoughts or nuances of thought within sentences. So let's have a look at the most common uses of commas in scientific writing with a couple of examples. So probably the most common situation of when used for using a comma in a sentence is after an introductory word in a sentence. These are often adverbs such as however, for example, subsequently, any kind of single adverb. Yeah, we, more often than not, these are going to require a comma to start the sentence. Um, Next is, and similarly, after an introductory phrase, these are often prepositional or adverbial. Remember, prepositional refers to anything related to prepositions. And remember, these are words that show relationships between different elements of a sentence. So, a prepositional phrase, well, it's a group of words that begins with a preposition and provides additional information about time, place, direction, cause, manner, or possession. So examples of these: so time, this can be before, after, during, since. Place would be in, on, at, under, between. Direction, these would be to, from, into, out, of. Cause or reason, these would be because of, due to, as a result of. And manner would be with, by, and like. So we can see in these examples here: before enrollment, patients were interviewed. After analyzing the data, the researchers concluded that the treatment was effective. So remember, after either a prepositional or adverbial introductory phrase. Um, so remember, an adverbial opening phrase, similar to a prepositional one, this is a phrase at the beginning of a sentence that provides information on how, when, where, or why the main action happens, and it's usually followed by, as I mentioned, a comma to separate it from the main clause. Next, we have commas should be used to separate independent clause. So remember, an independent clause is a group of words that contains a subject and a verb and expresses a a complete thought. So, for example, the treatment reduced inflammation, but further studies are needed to confirm efficacy. The placebo group exhibited no improvement, so the intervention was deemed effective. So you can see here how these examples both separate independent clauses. In our next example, um, we can see how commas are used to set off a non-essential clause. In other words, enclosing additional thoughts or qualifications. So, for example, here we have the clinical trial, which was conducted over 6 months, showed promising results. So the clause, which was conducted over 6 months, well, this adds extra information, but it's not essential to the main point of the sentence. The commas indicate that the sentence remains clear and grammatically correct, even when the clause is removed. In the next example, the new drug, which was approved by the FDA last year, has shown promising results in early clinical trials. So even with that non-essential clause omitted, the new drug has shown promising results in early trials. That full sentence is still grammatically correct and makes sense. So the next example on comma use is to set off appositives or interrupting words. So an appositive is a noun or phrase that renames another one. So for example, Dr. Smith, a leading expert in oncology, conducted the trial. So here we have commas. They set off a leading expert in oncology, which renames Dr. Smith and provides some additional information. In our next examples, the study was, however, limited by a small sample size. The commas properly set off, however, as an interrupting word and improves the readability of the sentence. Next example of comma use is when we itemize words. So when we have a list or something, so here we can see the study analyzed blood pressure, heart rate, cholesterol levels, and glucose levels. So here the commas help clearly separate each symptom in the list or each assessment in the list, ensuring readability. The Oxford comma before and glucose levels maintains clarity and consistency. Similarly, you can see this in our next sentence. The symptoms observed in the patients included fatigue, nausea, dizziness, and shortness of breath. So similarly to itemizing lists or itemizing words, we can have commas for use when we're itemizing word groups. So for example, the clinical trial included patients with hypertension, individuals with a history of heart disease, and participants over the age of 60. The sentence lists words groups here rather than single words, and then again the Oxford comma is used to separate them for clarity. So let's just talk a little bit about the Oxford or serial comma. So this comes before and or in a series or list of at least 3 items. So here we can see in our prior example, the clinical trial included patients with hypertension, individuals with a history of heart disease, and participants over the age of 60. So here we can see at the end the Oxford comma separates the last group for clarity. Use of the Oxford comma prevents ambiguity by ensuring clarity, especially when items in the list contain multiple words. A scientific writing values accuracy, of course. The Oxford comma helps avoid misinterpretation and overall enhances the precision of your writing. It's consistent with style guides such as the APA, the American Psychological Association, the Chicago Style, and the AMA, American Medical Association. All these style guides recommended for its use. I do stress though that the Oxford comma is mainly used in American English. British English does not include the Oxford comma, and all these style guides that I gave an example referred to, these are American style guides. So to summarize, commas play a crucial role in scientific writing. They ensure clarity, precision, and logical structure. From separating introductory elements to itemizing lists and maintaining consistency with the Oxford comma, proper comma use, well, it really enhances the readability of your writing and reduces ambiguity. So by following these tips, you can strengthen your writing, effectively communicate the complex ideas you may be trying to get across with accuracy. So keep these rules in mind, and your scientific writing, I hope, should be clearer, more professional, and easier to understand. Thank you.